The history of the University of Rochester School of Medicine and Dentistry is an illustrious one in the areas of health humanities and ethics. Back in 1977, George Engel came up with the idea of the biopsychosocial approach. And what that really meant was that in order to understand the patient, you couldn't just understand their medical condition, you had to understand the whole person. Every clinical encounter is a moral encounter. And in order to take care of our patients, we really need to understand the underlying ethical issues that pervade our lives. And so in 2021, the dean decided that this was going to become the Department of Health, Humanities, and Bioethics.
So taking care of patients is a moral endeavor, and it requires the use of scientific knowledge, but in the application of caring for humans. We are at the home of the biopsychosocial approach to medicine. The work that we do helps apply our scientific knowledge in the care of those individuals.
Coming to the U of R, where there's such a strong role of the biopsychosocial model, and seeing how that really plays out in the presence of health humanities has really been an organic shift to looking at that in an academic way. My role as a physician is really directly correlated to my role in health humanities. This isn't something that's separate from medicine, it's really what we do in medicine all the time.
We are the academic home and the practice home for the biopsychosocial model, and engaging with our activities, our educational pathways, and our offerings is a way to embody that model in ways that are going to help solve many of today's complex healthcare problems.
We have a multitude of enrichment opportunities for students and trainees at the University of Rochester Department of Health, Humanities, and Bioethics. In the medical school, we offer pathways. Students elect to join us for this. They take some classes, and they also get to do research opportunities so that they can start exploring issues in depth, as well as learn new techniques, methods of scholarship and research. It's not limited just to the medical students. We have students that can come from across the campus, students who are trainees and in fellowship who want to come and explore these issues as well.
The role of health humanities and bioethics education in medical school goes further than just understanding the basic science or the application of clinical science. If you ask almost any patient what makes a good physician, it's usually a clinician that listens to the patient. They are interested in the human experience and what this illness experience means to this individual.
So it's been a great privilege to teach our students here at the University of Rochester School of Medicine and Dentistry. The students that come to us interested in health humanities and bioethics topics bring a real motivation and passion and creativity. They're often searching for some kind of disciplinary experience that's outside of the norm for them, that adds something, that adds a perspective or some kind of an idea or concept that they can't find somewhere else, and that helps to open up an issue or a problem that they're confronting.
Our master's students are a real mix of professions, disciplines, backgrounds, age groups, experiences, and this really enriches the classroom experience and enriches our experience as educators. We come to it from a particular perspective, but everybody brings their lived experience of what their perspective on healthcare and illness, the patient experience, the doctor-patient relationship is.
Students working with the Department of Health, Humanities and Bioethics get this fantastic experience to kind of explore the humanistic dimensions of their clinical practice. They get to, explore a topic that looks at the philosophical or artistic or social emotional dimensions of healthcare, and then they get to use that to kind of reflect on their own clinical practice.
The Advanced Certificate Program is open to all University of Rochester employees. It's open to anybody in a graduate program who is interested in going into healthcare. It's a program that's designed to make sure that we teach the knowledge and skills necessary to apply the scientific knowledge that one needs in clinical care to the care of humans.
I really enjoyed the visual arts and healthcare class. Being able to spend the class in the art museum and using our works as our texts was really special and unique, and not something I was ever able to do in my coursework leading up to medicine.
There's all sorts of visual codes about how different diseases are represented, and learning to tease that out is something that we do, and we work very closely with physicians as well in this course.
I think it's really important that we also collaborate with other clinicians and other scholars throughout the medical school. We have research projects with the Department of Neurology. They're looking at patient-reported outcomes, and what we bring to the table is talking about some of the ethical issues.
So Eastman Performing Arts Medicine, we usually shorten it to EPAM. We are a collaboration between the Eastman School, Memorial Art Gallery, the Teaching Hospital, and the School of Medicine and Dentistry. And we look at our program in 4 pillars. So we think about the healthcare for performing artists. We think about how to integrate arts into the healthcare environment. So that might be music in the lobby performed by Eastman students. It's collaborations here with the Memorial Art Gallery and how we can bring those images to patients. It's also how we use creative arts therapies in the hospital. So music therapy, art therapy, drama therapy, and we're looking to expand that. And then how do we research this impact on our patients? How do we know that this is actually working and why this is working on a neurologic level?
Medicine is an essentially visual engagement with human beings, and there is a very long history of the connection between medicine and the visual arts. The part that's really recorded is from the 16th century forward with anatomical atlases. And actually at the Minor Library at the School of Medicine and Dentistry, they have one of the world-class collections of these historical atlases. One of our key expressions is we don't see things as they are, we see things as we are. And over the last 20 years, we have worked with all of the first-year medical students entering to the University of Rochester School of Medicine and Dentistry, the School of Nursing at the U of R, as well as in other programs, all come here to develop their basic skills of observation.
Student research is a really important part of the department's culture. It's a way for us to develop students' research skills, give them a taste of faculty life, and also bring them into the broader research culture of the department. That benefits the students because often they can receive a publication out of the research, which helps them develop their career.
We're a Department of Bioethics and Health Humanities, but we also do a lot in clinical ethics consultation. That's clearly at the bedside with patients and clinicians and working with them to help understand the doctor-patient relationship, the biopsychosocial approach, to deal with controversies, conflict, difficult conversations that patients and families and clinicians and other individuals may be having.
Our clinical ethics team is an interdisciplinary team that's made up of individuals who have spent time learning about ethics, and they have done fellowships and they are certified by the Association for Bioethics and Health Humanities as ethics consultants.
I think the most important thing to me regarding the ethics program here is the ability to sort of have a very multidisciplinary team and get to see parts of the hospital and parts of medicine that I would otherwise see as a surgeon.
My engagement in the clinical ethics program is important to me for a number of reasons. One of which is it brings great value to me. I really enjoy the discussions that we have. I think it makes me understand the decisions that I make when I'm a patient's physician and not their ethics consultant better.
In my practice in palliative care, there is a lot of intersection between ethics and palliative care, and so to be well versed in one helps you to practice the other better.
As a nurse and now as a nurse practitioner, I really want nurses and APPs to have a voice at the table of ethics, not only to understand what ethics is and how they can participate, but how they can impact patients' lives and all of our peers.
Paul Shivey went to the University of Rochester as an undergraduate. He stayed here and then graduated from our medical school. He then stayed and did his residency in psychiatry. So he spent many years in training here at the University of Rochester. and wanted to pay back, and his generosity is what created the center. The Paul M. Shivey, MD Center for Bioethics actually has 3 missions. The first mission is to create a clinical ethics consultation program for the University of Rochester Medical Center and its affiliate hospitals. The second goal is to have a clinical ethics program that's actually more regional, so including our local hospitals, but also hospitals across Western New York. The third goal is to be outward-facing and to engage with the community, because again, in order to provide good medical care, we need to have good relationships with our community and partner with them in understanding our health and our healthcare needs.
The mission of the Paul M. Shivey Center for Bioethics aligns closely with the work of clinical bioethics. We are grateful for the support that his center provides us in our work and for others who support ethics education and ethics consult services across the region.
This is an exciting time to engage with the Department of Health, Humanities, and Bioethics. If you join us, you will meet a group of interdisciplinary, curious, and collaborative partners.
We're just so much fun.
It's a terrific place to work.